have to say, mental health, the 2020 challenge and solutions within reach. I am really honored to be here on this very professional-looking stage to shed light on this very, very important issue and to hopefully share with you some important insights. So I'm a parent, and for any parents out there, you know, we think a lot about our kids' health and we want them to be healthy. So soon after they're born, if we're going to take them outside, we lather them up with sunscreen. When they learn to bike ride, we make sure they're wearing their helmet when they go outside. And we brush their teeth, even when they don't want us to. And that's because we really take it very seriously to think about their physical health. But I recently saw a TED Talk that made this point, that as parents, we kind of have a routine about taking care of our kids' physical health, but we don't really have a parallel routine for their mental health. We don't have sort of basic things for upkeep. We don't really necessarily know what are the warning signs we need to think about in case there might be a problem. And, you know, that's kind of a strange thing. I mean, we do take them to the doctor, and I am a doctor. I'm a pediatrician. And when you go to the doctor, you know, they check certain things, but actually in the medical field, there's a similar strong focus on medical issues and not so much on mental health issues. So I was very fortunate. I had great training. I went to Harvard Medical School. I was with professors who were, you know, national experts on complex diseases, and I learned a lot from them. When I decided to become a pediatrician, I trained at Children's Hospital Philadelphia. It's also a great place, and it's a wonderful place where they really do care about the kids. They know the cutting-edge treatments, and they also care a lot about teaching. So, you know, I kind of had learned a lot. I should have been pretty ready. And I learned about things, you know, when I left there, I knew a lot about treating disease and how to assess kids. I learned that when I went out into practice, it was going to be important to screen them for all kinds of problems, including their vision, make sure they didn't need glasses. I got really good at using my stethoscope, checking kids' hearts, listening to their lungs, making sure that they were breathing okay. You know, asthma is a common problem. It affects about 9% of kids. So it's good that I learned a lot about that. So I was really well trained, but I was not well prepared. Because when I went out into practice and saw patients out there in the community, I was directing my focus on their physical health, their development of the kids, but many, many families and patients were concerned about emotional issues or behavioral concerns. And I didn't know what to do. Mental health was the elephant in the room. And I'll share with you that this is not an unusual problem. Many, many pediatric trained people and all kinds of primary care providers aren't really learning this in their training. And there's a story I still remember very clearly and regret it quite a bit. I was assigned a lot of patients when I started in practice, and many of them had the diagnosis of ADHD. I remember this one boy, Kevin, great kid, doing well in school, lots of friends, played a sport, really doing great. And him and some of the other kids who had that diagnosis, they were also doing well. I thought, you know, I kind of have this public perception, like, you know, I'm not really sure this is a real disease, and I think maybe the medications are overused. So I took them all off the medication. Well, about 6 weeks later, Kevin came in. I can still picture his face. He hung his head. He was demoralized. He told me, I don't know what's wrong. I can't seem to get my work done. My thoughts are ping-ponging around my head. I sit down to do my homework, and I can't get it done. He's gotten in trouble twice in his classroom, which had never happened before. And he looked at me, and he said, do you think I could restart my medicine? And that was a really powerful moment for me. I had gone into medicine to help kids, and here I was with my lack of knowledge. I had hurt this young boy. I was crushed by this elephant. I realized I had a lot I needed to learn. And I did learn. I learned that 1 in 5 youth are affected by mental health conditions. It's twice as common as asthma, and although I could really do well with any kid who came in with asthma, I was lost for mental health. It's so common, in fact, that I suspect everyone here in this room knows someone who's affected. Could be someone in your family, a friend, maybe even you. Now, people realize that, of course, everything, like a lot of things, happen on a spectrum or a continuum. So on one end, you know, we all have ups and downs. We have days we can't focus. We might feel blue sometimes. But if those symptoms are persistent and they're severe, and they're starting to interfere with how someone functions, like how they get their work done, or how they're interacting with the people around them, their family, their friends, then it's time that they're moved into that yellow zone or red zone, and they need some help. Now, these conditions happen across the population, and you might be surprised to know that 50% of people with a mental health condition in adulthood, those symptoms started by the time they were 14 years old, and most of them by the time they were 24. So really, people who work with kids need to be aware of these conditions and understand how to address them. So what am I talking about? These are the common mental health conditions that happen in kids and teenagers: anxiety-related disorders, depression-related disorders, and attention deficit hyperactivity disorder. Now, much more rare, 1% or less, is bipolar disease or schizophrenia. It happens, but it's not common. These are the most common conditions. So the 2020 problem is this: 20% of kids have a significant impairing mental health problem, and yet only 20% of them are getting the help they need. Why? There are multiple reasons for this problem, these barriers. There's one, the stigma. People are ashamed, they feel uncomfortable about it, they don't want to talk about it, they don't want to tell anyone. I will say that the young generation is doing a lot to talk about things that before people felt uncomfortable talking about and discussing, and I really applaud this generation because you guys are changing the world. There's also a stigma, though, even about the treatment. Some people don't understand what is really psychotherapy. What is that going to involve? They picture themselves lying on a couch, and that's not typically what happens anymore. And there's also a stigma about medications. People have a lot of fears, and they don't realize that the medicines have been studied, and they're safe, and they're effective. Now, another enormous problem is that there's a huge shortage of the specialists who were trained in their training to handle these mental health problems in kids. People like child and adolescent psychiatrists and child psychologists. There are fewer and fewer out there, and unfortunately, the problem is not getting better, it's getting worse. So that means that other people that work with kids, like pediatricians or nurse practitioners or PAs or family doctors, we all need to be able to step up and take care of these kids. But even today, 20 years after I finished my training, the issue persists. People are not getting adequately trained in these problems. It's recognized. The people in the training programs know that they're missing this, and yet it's not significantly changed yet. Now, what are the ripple effects of this untreated mental health problems? Well, the kid themselves feels awful, and that affects all the people around them. It can lead them to not do well in school. And then it has kind of problems for their whole life potential. Increased risk of substance use. The homeless, the incarcerated, those have high rates of mental health problems. And suicide. 90% of suicides occur because someone has a mental health problem. And unfortunately, suicide's on the rise in young people. And then there's suffering. When someone has a mental health condition that's untreated, there's a lot of negativity. And they experience it, their siblings experience it. It affects the whole family, the community. It can affect all of society. And I urge you to kind of take another look if you are someone who maybe works or interacts with kids, because sometimes people perceive, oh, that's a bad kid. Maybe they seem really lazy, or they're always antagonizing everybody, or they're irritable all the time. Well, sometimes that bad kid is actually a kid who's just suffering from a bad disease, and they need help. So what is the help? Well, there's three basic components of the therapy. One is the social and support networks. And this is kind of like the parallel of like the teeth brushing, what we should all be doing with all the kids. You know, understanding how important sleep is for mood, how important exercise is, making sure kids have time to take a break and relax, making sure they have time to do something that they feel good about, that they can achieve in, whether it's school or not school. Let them know that it's important to have a social life. And also, sometimes to take time to do something nice for other people. These are all things we know improves our overall well-being. And of course, love the kid and support them. But even if you're providing all that, these are diseases, and they can happen anyway. So then you need extra professional help, like psychologic therapy. Now, with little kids, it's important for parents to get extra help to be able to handle these challenging behaviors. You know, it's funny if you think about it. Most people who delivered their children went to childbirth classes. But then we have a baby, and most of us don't go to parenting classes. And I think if there's any parents in the room, you probably would agree that it's the hardest job in the world, and yet we don't consider really going to classes. Now, for the person themselves who's suffering, there's all kinds of psychologic therapy, and if you're not aware of what's out there, you might not know. So typically, it's time limited, typically 3 to 4 months. It's very much focused on building skills, learning coping techniques, how to handle different situations. And it's evidence-based. It's been studied, and it's effective. So 2 good examples are cognitive behavioral therapy and interpersonal therapy. So if you're looking, you want to look for something that's evidence-based. And then there's biologic therapies. Now, these are diseases of the mind. So medications can make a difference, and they have been studied extensively in kids, and they are safe, and they are effective. So what we know is that if someone is in that yellow zone or all the way over to the red zone, you really want to give them everything we've got to help them get better, and they can get better. And if they're somewhere in the middle, then maybe it will be parts of some of these things. So treatment really works, and that's what's really profound to remember, that most people, depending on the condition, 70 to 90% will get better. It's more effective than a lot of the treatments we have for medical conditions like heart disease or asthma or diabetes. I wanted to share with you just a little bit about the REACH Institute because this is how I developed ability and skill to be able to handle the mental health care problems that came up in my office. And the REACH Institute was started by a child psychiatrist who recognized these problems, that there was a shortage of good providers who were trained, that the people on the front line weren't knowing how to deal with this. And so he worked with a lot of academic experts, looked at the evidence and the research, and tried to put together good training programs to help people like pediatricians like me and other pediatric providers and schools and therapists so they would know what do they need to share with the kids. And so I'll share with you an experience I had in my office. Now that I know what to do, it's so rewarding because I can make such a big difference for these kids. So I had a teenage girl, Mina, and she came to me because in her office, in school, she needed a note because she had missed so much time. And so she came in, she needed a note because she had missed 10 days of school in November. And I'd known her for a long time. She sailed through middle school, but in high school, her mom shared with me she started having all these episodes of problems, throwing up, stomach aches. She'd missed all this school. They took her to a specialist, couldn't find anything wrong with her, and they found out that they didn't know what to do, so they came and brought her to me for a note. And it turns out that all this started because she had this really hard test in school. She was freaking out. She had a big panic attack, and she vomited. And that was so traumatic for her that she began to have panic attacks about having panic attacks, which actually is really common. Now, anxiety is very treatable, and so she got treatment, and she's doing so much better. She hasn't missed a day of school, and she's really sailing along. And Mina has some techniques that I'll share and just briefly go over with you because I think I'm running over time. One of her techniques is distraction. So she uses her mind to change the channel, and this is kind of based on cognitive behavioral therapy, where she takes, when she starts to feel that she's stressed, she makes herself think about something different just to give her relief so that feeling can pass. So what she likes to do is look around the room and spell everything that she sees, and because she's a bright kid, sometimes she has to spell it backwards to keep her brain engaged. Or she'll choose a color and notice everything around her that is that color. And it just helps the feeling pass. Another thing she does is the fist squeeze. We all know that when you exercise, it releases endorphins, helps us feel better. And so it also eats up adrenaline, which contributes to the intensity of those hard feelings. And so if you squeeze your fist as tight as you can for 10 seconds in a moment where you're really having a hard time, it can help you gain back your control. And breathing. Probably all of you know breathing can be helpful in a tough situation, but you might not know why. And it's because it pulls on a nerve that pulls on a nerve that basically causes your body to become more physically comfortable. It's called the relaxation response. So sometimes, even despite really good support, even in the case where maybe you think, that kid has everything, why would they have a mental health problem? What do they have to worry about? It's a disease. It can happen to anyone. And so if someone's slipping down the continuum into the yellow zone or the red zone, they need help. And so I hope that you'll kind of reach out to people and let them know, like, there is safe and effective care out there, and they deserve it, and it works. If we saw a kid with a fever and a rash, we'd say, you better go to the doctor. Or somebody who broke their arm, we'd say, you better get some medical help. But we also need to be doing that for mental health problems. So I'd like everybody to just quickly snap a photo of this slide, because in case you know anybody now, or maybe not now, but maybe someday, you're going to come across someone who maybe could benefit from some of this information. And it's certainly not a substitute for professional help, but it might give someone some resource or some additional information to get them moving in the right direction. So I've learned it's not enough for me to say to my patients when they come in, I'm just going to check what you're seeing, and then, you'll be on your way. I really need to think about how they're seeing. Are they looking out and being afraid? Are they overwhelmed by everything they see? Are they having trouble focusing? Are they looking out, but everything's kind of dark and hopeless? I need to pay attention to that. So the distorted view of the mind cannot be overlooked. Thank you.